What if I told you that your chest pain could be your heart sending out an SOS signal? Not all chest pains mean a heart attack, but they could be a warning light on the dashboard of your body. So how do you know if it's gas from last night's pizza? Or angina? Welcome Disease Decoded series at DocDecoded, where we simplify health, one heartbeat at a time. Today's topic is something that affects millions globally, but is often misunderstood or ignored: angina. Stick around till the end to test your knowledge with our quick quiz and uncover some surprising facts about your heart you probably didn't know. If you find the topics informative, please do subscribe immediately and click the bell icon. Let's decode it. Angina, also known as angina pectoris, is chest pain or discomfort that happens when your heart muscle doesn't get enough oxygen-rich blood. Think of it like your heart crying for help because it's not getting enough fuel. But here's the twist. It's not a disease. It's a symptom of an underlying heart problem, usually coronary artery disease, CAD. This episodic clinical syndrome is a result of transient myocardial ischemia, which means dying or near dying of tissue of heart due to low or no oxygen caused by blockage. The typical patient with angina is a man more than 50 years or a woman more than 60 years of age who complains of episodes of chest comfort, usually described as heaviness, squeezing, smothering, or choking, and only rarely as frank pain. Not all anginas are created equal. Let's break it down. Stable angina, predictable, happens with exertion, goes away with rest. It's like your heart saying, take it easy. Severity of pain or discomfort is not at its most intense level at the outset of the symptoms. It typically lasts 2 to 5 minutes and disappears spontaneously. Unstable angina, unpredictable, can happen even at rest. Warning, this one's dangerous. It might be a prelude to a heart attack. Variant or Prince metal. Angina, caused by coronary artery spasm, not blockage. It usually happens at night or early morning, and it can be severe. Microvascular angina, less known, often affects women and is related to problems in the tiny blood vessels. Which type of angina is a red flag that a heart attack might be around the corner? When the patient is asked to localize the sensation, he or she typically places hand over the sternum, sometimes with a clenched fist, to indicate a squeezing central substernal discomfort. May radiate to the either shoulder and to both arms, back, interscapular region, root of the neck, jaw, teeth, epigastrium, or upper abdomen. Therefore, you may get confused to decide whether it is heart origin or other localized pain, often triggered by physical activity or stress. If it is temporary and relieved within 5 minutes of stopping the activities, then it is called exertional angina. But wait, women, older adults, and diabetics may have atypical symptoms like fatigue, shortness of breath, nausea, pain in the neck, jaw, or back. In fact, in such people, angina may be atypical in location as well and not strictly related to provoking factors. Although episodes of angina typically are caused by exertion, like exercise, hurrying or sexual activity, or emotions, stress, anger, fright, or frustrations, and are usually relieved by rest, angina also may occur at rest or while in a recumbent position known as angina decubitus. The patient may be awakened at night by typical chest discomfort and difficulty in breathing. Angina may also be precipitated by unfamiliar circumstances. Heavy meal, exposure to cold, emotional stress, or a combination of these factors. Angina occurrence may be seasonal, occurring more frequently in the winter and temperate climates. Did you know that some people experience silent angina? That means no chest pain at all, especially in people with diabetes. Scary, right? That's why the importance of annual health checkup and health insurance in today's date. Causes and risk factors. Now, let's dig deeper. What causes angina? The main culprit is coronary artery disease, CAD, where plaque builds up in your arteries, narrowing them and reducing blood flow. Plaque you can consider as the block by some substances composed of fat, blood clots, blood protein, etc. Risk factors include diabetes, high blood pressure, high cholesterol, smoking, obesity, stress, sedentary lifestyle, family history of heart disease. All these factors accelerate coronary atherosclerosis in all sexes and at all ages. Regular exercise helps prevent angina. However, if you have already developed angina or any kind of intermittent chest pain, please do not exercise without expert advice. This is because when you exercise, your heart needs more oxygen, and if you've already developed blockage, you may have chest pain instead. So how do doctors figure out if it's angina? Exertional angina typically is relieved in 1 to 5 minutes by slowing or situation of activities, and even more rapidly by rest and sublingual glycerin. Indeed, the diagnosis of angina is usually suspected if it doesn't respond to a combination of these measures. It starts with a detailed history and physical exam, but the detective work doesn't stop there. Common tests include ECG, electrocardiogram, to checks electrical activity of the heart, echocardiogram. It uses sound waves to look at heart structure. Coronary angiography, the gold standard for suspected coronary block. Here, dye is injected into arteries to find blockages. Blood test, to rule out heart attack. Stress test, measure heart function during exercise. Let's know an interesting fact. The heart beats over 100,000 times per day, but it only needs a tiny 20% of your blood supply to function normally. Isn't that efficient? Do you know anyone who has suffered angina symptoms? You can write your story. Treatment for angina depends on how severe it is, but the goals are the same: reduce symptoms, improve quality of life, and prevent heart attacks. Lifestyle changes. You should definitely adopt these immediately, irrespective of age, to reduce long-term health risks. Stop smoking, eat heart-healthy food, exercise regularly, manage stress, manage sugar level in diabetes, and control blood pressure. Medication, nitrates, like nitroglycerin to relieve pain, beta blockers, reduce heart's oxygen demand, calcium channel blockers, relax blood vessels, antiplatelets like aspirin, prevent clot, statins, lower cholesterol. These works in early stages. In advanced stages, some surgical procedure may be needed. Procedure if needed are angioplasty plus stent, opens up blocked arteries, coronary artery. Bypass surgery creates new paths for blood to flow. If you're still watching, that means you're finding this helpful, so why to keep it to yourself? Hit that subscribe button and share it with someone who might benefit too. Let's learn, stay healthy, safe, and disease-free. Can angina be prevented? Absolutely. Here's your heart's wish list. Stop smoking. Your heart hates nicotine. Eat smart. Go for the Mediterranean diet. Olive oil, fish, veggies. Move more. Even a 30-minute walk daily helps. Know your numbers. Monitor BP, sugar, cholesterol, de-stress, yoga, music, or even just deep breathing can help. Did you know? Laughter may improve blood vessel function. So yes, watching funny cat videos might be good for your heart. Chest pain is not something to ignore. Listen to your body. It's smarter than you think. If you or someone you know experiences these symptoms, don't play the guessing game. Get medical help fast. Do you know which gender suffers the most? Yes, you guess it right. Males. Male constitute around 70% of all patients with angina pectoris, and an even greater proportion of those aged less than 50 years. It is, however, important to note that angina pectoris in women may be atypical in presentation, as we had discussed. Please be mindful of these. Hope you found this video helpful. Please drop a comment if you want us to decode any other health mysteries for you. Do not forget to like, share, and subscribe. Until next time, stay healthy, stay curious, and always listen to your heart.